Fibroids. What are fibroids? How can you treat fibroids? Can you get pregnant even if you have fibroids? In this live session today, we are going to talk about fibroids. Remember, if you have any questions, you can ask me your questions live and I will be able to answer all your questions. Gerard Massa, the health educator, is the name of the channel, and I welcome you, my friend, for today's live session. And without further ado, we are going to talk about fibroids. What are fibroids? So when we to begin this live session, we shall begin by the definition of the term fibroids. A fibroid is a non-cancerous growth which actually develops inside your womb. When we have your uterus, and then there are some swellings that are developing, there are some masses that are developing, but they are not cancerous. We call these fibroids. So how can you tell that you are having fibroids? Mu video yaffe ya leero tuli kwogera ku ekigambo oba topic gye bayita fibroids, oba mu Luganda bye tuyita ebizimba oba ebigalanga. Omanya otya nti olina ebizimba? Osobola okufuna olubuto wadde nga obadde olina ebizimba? Tuli kwogera ku bino byonna byonna mu video yaffe ya leero, beera naffe. So we've said that fibroids are non-cancerous growths which develop inside your uterus, and we've said that these growths or these swellings or these masses can only be identified by doing some tests. So without further ado, we are going to discuss the commonest sites where these swellings can develop. Now, when you do an ultrasound scan, when you go for a checkup in hospital, and then your doctor requests for an ultrasound scan, you will always realize that the doctor who has done the scan or the doctor who has done the ultrasound scan the doctor might tell you that you have what we call a submucosal fibroid. You may actually get this on your report, the doctor telling you that you have an intramural fibroid or even a pendiculated fibroid. What do they mean when they say that you have a submucosal fibroid? When a fibroid is growing inside your uterus, we call this a submucosal fibroid. When it is growing in your myometrium or on the walls of your uterus, the big walls which actually bring about contractions when you're giving birth, we call that an intramural fibroid. And then when it is growing outside your uterus and maybe it's forming kind of like balls, kind of swellings outside your uterus, we call this a pendiculated fibroids. Today's topic in today's Fertility Live Clinic, we are discussing fibroids. Remember to subscribe so that you do not miss new videos we release every day. Gerard Massa, the health educator, is the name of the channel. On this channel, we create awareness about fertility and reproductive health. We've talked about the sites of fibroids, and we've said that fibroids can actually grow inside your uterus. They can grow outside your uterus, and they can actually grow way far away from your uterus. So we've talked about the different types of fibroids. Togedde ku ebika ebyenjawulo ebya fibroids ne tugamba nti waliwo ekika ekya fibroid kye bayita pendiculated fibroids. Bino biba bibeera wabweru w'abaana. Ne twogera ku ekika ekirala ekya fibroid kye bayita submucosal fibroid, and then ne twogera ne ku kirala kye bayita intramural fibroid. Ne tugamba nti intramural fibroids ebiseera ebisinga kye kino ekika kibanga kwegamba kikula wabweru w'abaana. So we are proceeding. You've done the ultrasound scan and your doctor is asking what could be happening. How can you discover that you have a fibroid? What is going to happen is that most likely your doctor will do what we call a pelvic ultrasound scan. Now, the pelvic ultrasound scan is a special check which is done in hospital whereby special images, special pictures will be taken of your womb, and then a conclusion will be made as to whether you have a fibroid or you do not have a fibroid. The best way to confirm that you have fibroids is by doing a pelvic ultrasound scan. The omugaso gw'okwawuka oba engeri emu yokka gy'osobola okumanya nti wandibanga olina ekizimba olina okuba nga okola scan oba kye tuyita ka TV, era dokita wo aba ajja kubuulira oba olina fibroid oba tolina fibroid. Gerard Massa, the health educator, is the name of the channel, and we are proceeding with today's video lesson. We are talking about fibroids. So when you have been told that you have fibroids, chances are these fibroids or these swellings have been around for some time. What happens is that you actually should look at the best treatment options. The first treatment option, before we actually go into the details of the medical part of it, you should actually look at your diet. If you have been told that you have fibroids, you should avoid foods that are high in processed sugars. For example, cakes, cookies, and then also rice, and also foods that are very high in processed sugars, like those foods which contain fructose and then also sucrose. You should avoid those foods, because the more you eat these foods that are high in these sugars, the more your chances of having high levels of estrogen. And remember, estrogen and progesterone are very important hormones because they help in the regeneration of your uterus or your uterine lining. So if you consume more of these, then they are going to cause more production of estrogen, and then there's going to be more regeneration of your uterine lining or the inside of your uterus. Remember to ask me all your questions about fertility. In case you have that question, you would like to know about fertility, about your reproductive system, ask me down below in the comments and I will answer your questions. We are talking about fibroids. One of the commonest asked questions on our channel is about fibroids. So we are proceeding. Having done an ultrasound scan, your doctor will be able to confirm that you either have a fibroid, or you do not have a fibroid. When you have a fibroid, your doctor will do the measurements. If the fibroid is measuring at least around 100 millimeters, that's roughly around 10 centimeters, then there are high chances that your doctor will recommend a special procedure in hospital, also known as a myomectomy. So this procedure will be done in hospital, whereby they will extract or they will remove this fibroid, at the same time preserve your uterus. So a myomectomy is a special procedure which will be done in hospital to remove the fibroid but preserve your uterus. And then, of course, if the fibroid has really eaten up a large portion of your uterus, then your doctor will recommend a procedure known as a total hysterectomy, where where the whole of your uterus will be removed. Not a very good procedure, but if at all they discover in the theater that the uterus has completely been destroyed by the fibroid, then your doctor will recommend a total myomectomy. But if at all the fibroid has not really destroyed completely your uterus, then your doctor will actually most likely recommend what we call a partial hysterectomy. So we are talking about fibroids. Remember to subscribe so that you do not miss new videos we release every day. And remember to ask me all your questions about fertility. I will be able to answer all your questions. So we've talked about fibroids. How can you tell that you have fibroids? We've talked about the treatments. We've said that you can begin with diet. A diet that is rich in green leafy vegetables is very, very important. And then also we've said that if at all the fibroid is very big, then most likely your doctor will recommend what we call a myomectomy, where part of the fibroid will be removed. Remember to ask me all your questions in case you have any questions, and I will be able to answer your questions. Gerard Massa, the health educator, is the name of the channel, and we are proceeding with today's live session. And how can you tell that you have fibroids? You are asking yourself, now we have talked about fibroids, we have talked about where they grow, and we've talked about the treatment, but we've not talked about the places where the commonest signs and symptoms of fibroids. The only way, the first sign of telling or identifying that you could be having a fibroid is by actually realizing that you will have constipation. The main reason is that as this fibroid, as this swelling is growing, there are high chances that it's going to press on your rectum. The rectum is specifically that part which stores fecal matter. So it will actually most likely press on the rectum, and then as it is pressing on the rectum, it will actually lead to constipation. So constipation is sign number one. And then also there's going to be lower abdominal pain. And then also there's going to be bleeding. If at all a woman is having PV bleeding, and then this bleeding is having heavy clots, I'm not saying that it's the only cause of bleeding, but you could actually most likely be having a fibroid. So remember to have a pelvic ultrasound scan so that you can know whether you are having a fibroid or you are not having a fibroid. Julia Dimasa, the Health Educator, is the name of the channel. Remember to subscribe so that you do not miss new videos we release every day. On this channel, we talk about fertility, we talk about reproductive health. Thanks a lot, my friend.